Paramedics are here.
Medic 54 to County Priority 1.
Ma'am, I'll go ahead and take over.
Ma'am, tell us what happened.
She was outside playing out in the backyard with the dog. And I came inside because the phone rang and the dog was barking. And when I looked back at it, I couldn't see her. The full cover was up.
She's pulse with Nick. I started CPR.
Okay. We're going to take good care of her, okay?
Please tell me my baby's going to be okay.
When the tones drop and the dispatcher says child not breathing, even the most experienced and jaded paramedic's pulse will quicken just a little bit. Surveys of EMS providers consistently rank pediatric emergencies as among the most stressful psychologically and emotionally of any call that they run. And when it comes to pediatric arrest, the stakes couldn't be any higher. Add in the emotional distress of the caregiver and the unique pediatric sizing and dosing concerns, and it's no wonder that pediatric arrest induces more pucker factor in providers than just about any other type of call. But pediatric resuscitation need not be overtly stressful, chaotic, or rushed. In fact, many of the skills and techniques that we employ for adult cardiac arrest are equally applicable to even the smallest of our patients. That's what we're going to talk about on this episode of Medic Monthly. Pediatric patients make up 27% of all ED visits, and around 7% of those arrive by ambulance. Roughly 13% of EMS calls involve kids, and even fewer than that involve cardiac arrest. Bottom line, we just don't run enough pediatric cardiac arrest to feel proficient, but that doesn't mean we can't be proficient. When it comes to pediatric emergency care, we're fond of saying children are not just little adults, to illustrate the importance of appropriate equipment sizing and medication dosing, and to emphasize the unique physiologic and anatomic characteristics of pediatric patients. However, that approach has inadvertently hampered our ability to manage a pediatric resuscitation effectively by fostering the perception that we have to utilize a different skill set when it comes to pediatric patients. The reality is, good patient care is good patient care, and there is very little about pediatric resuscitation that should be foreign to most EMS providers. Every resuscitation is unique, yes, and we typically have to adapt our methods and our treatment to fit the patient's clinical presentation. But pediatric patients simply represent just one more adaptation of long-practiced techniques and skills we already possess. Kids don't usually go into cardiac arrest for the same reasons as adults, that's true, but some kids do, and recognizing them is an important part of your resuscitation-oriented history and initial assessment. Even so, pediatric resuscitation isn't so much a different skill set as it is simply a shift in priorities and sequence of the things we already know how to do.